I don't see anyone yet. Is everyone else on the screen?
Yeah, yes, Regent Duvall, we have
Oh,
Director Critter and all others.
great. Okay, let me just change my screen to reflect that so I can see people. Okay, terrific. Welcome, everybody. Let me begin with two comments. First, heart goes out to everyone, part of Wildcat Nation. Yesterday was rough. It was quite the game and quite the season, but I know very tough. And secondly is that we will be missing Regent Penley today, and he is dealing with a heart procedure, and our thoughts go out to him. And I know we will get news later in the day and circulate it to everyone. I'd like to call the meeting of the March 25th, 2022 Research and Health Sciences Committee to order. Please remember that only members of the committee can provide a second to a motion. This is a virtual meeting, so please speak clearly. And as we always do, hey Bobby, good to see you. I don't know if you just joined, but it was just lamenting. I suspect you're still in San Antonio. Hell of a season, my friend.
Yeah, I heard all of your crepe you were hanging there for us, and we appreciate it.
You bet. As we always do, this meeting is being live streamed on ABOR Live. We have 3 items today, but we're going to take them a little bit out of order to manage folks' schedules. We will be first hearing from Dave Kreider on the Phoenix Biomedical Campus for a quick update. Then we will be talking about the University Health Sciences and Banner Health affiliation, and then we will move on from there to the Regents grants process. We first need to approve the minutes from the January 27th, 2022 committee meetings. Are there any questions or comments on the minutes? Great, hearing done, I move that the committee approve the minutes from the January 27th, 2022 Research and Health Sciences Committee meeting. Is there a second?
Second.
Moved and seconded. All in favor signify by saying aye.
Aye.
Any opposed? Any abstentions? Great, motion passes. All right, well, we will begin with Dave Kreider. And Dave, let me again apologize. We bumped you from the last meeting. Regret that. We're eager to hear your report. You've got a new name. You'll need to share with us the significance of that. We've got 10 or 15 minutes and look forward to the conversation. Over to you, my friend.
Thank you, Regent Duvall. And if we could cue up the slides, I would appreciate it. And go to the next slide. So the PBC has been a significant success for the Board of Regents in the city of Phoenix, but the potential going forward, I think greatly exceeds what's been accomplished to date. If you flashback to the early 2000s, Phoenix was by far the largest city in the United States without a 4-year medical school. ASU had a few hundred students taking part-time classes in a 9-to-5 downtown. And the city of Phoenix actually sent its economic development director to Chicago to recruit Midwestern University. And the reason I know that is I was the economic development director there, and I learned the difference between an osteopathic and an allopathic medical school during that trip. And then Dr. Mani Duvall approaches Mayor Gordon about locating a medical school in Phoenix, University of Arizona. That was followed up aggressively by Regent Chair Gary Stewart, President Likens, President Crow, and ultimately joined by NAU. The 30-acre PBC site was established. In the site, when the city established it, it had actually been set aside for an expansion of the Phoenix Convention Center and ultimately for an Arizona Cardinals football stadium. The PBC today has about 2 million square feet of built space. It's master planned for 6 million square feet. The PBC has always been an extremely high priority for the city of Phoenix, but the universities never had the connective tissue really to exploit the city's desire to promote the PBC. The regents, I think rightfully so, asked the Enterprise Executive Committee, the 3 university presidents and Director Arnold to establish a PBC office. I came on board about 18 months ago to help get that organized. I am getting a lot of support and a lot of direction from the university presidents on what we need to do to move forward. Next slide, please. So this is the most distinguishing characteristic of the PBC, and that's that we have 11 colleges among the 3 state universities physically located on or adjacent to the PBC. This is potentially extremely powerful environment if we want to work collectively to change what's happening in the center part of our city. The party is so good that Creighton University and Tufts have knocked at the front door with their party hats on to join the party. And those 2 universities are physically located now within a short distance of what has traditionally been the PBC. All of these colleges are walk to. So people potentially have the opportunity to interact with each other there. Next slide, please. So this is the most important thing that I have learned in my time trying to help us get organized. And I've really come to understand that the Central Phoenix environment and the PBC have really become the core of an emerging Central Phoenix health and bioscience ecosystem. You know, something that we always aspired to, but we questioned whether we could make it work. I think President Robbins, coming from the Texas Medical Center, President Cruz Rivera with his vision, and certainly President Crow really pushing and encouraging us to rethink the way that we think about what's happened among the universities in this downtown location. So if you think about it, we have 11 colleges among the 3 universities, plus Creighton, Tufts, and Maricopa Community College. We have 5 major hospital systems that are part of the Central Phoenix ecosystem, 4 of which are physically on the traditional PBC campus or directly adjacent to it. And now we have this ASU Wexford partnership driving the creation of an entrepreneurial ecosystem on the campus, essentially an innovation element. And if you think back to what the original vision for the campus was, the vision was health and medical education and the research associated with it. Now you have this 7-acre portion of what is now the Phoenix Bioscience Core dedicated to innovation being driven by ASU and its private partners. The other thing that's happened is downtown Phoenix has totally transformed into a dense, walkable, amenity-rich urban environment. A lot of these other campuses and innovation districts are in places where you don't have the residential density, you don't have the restaurants, you don't have the hotel inventory. We have all of that, and it's working extremely well for us. A few years ago, when I was the president of Downtown Phoenix Inc., I wrote an op-ed piece about the transformative changes downtown. I talked about the universities. I never mentioned the PBC, and that was a huge mistake. And I think the presidents have really driven home how that has changed. Next slide, please. So a big element of what we're doing is really to help tear down the silos that have traditionally existed in this bioscience core. We're a small office. We were set up initially mostly all hat and no cattle, but because the presidents have taken, have become directly involved in what we're doing, we are getting a lot of oomph. I believe that we have developed a really strong event marketing and communications program for the campus. We've gotten a lot of help by professionals from the ABOR staff, ASU, NAU, U of A, and the city of Phoenix. I do believe we are transitioning the Phoenix Bioscience Core from a collection of really nice things among the universities, TGen, to a place, a community where we have a lot more opportunity for synergistic activities. And we're also supporting what has become an extremely strong City of Phoenix Health and Bioscience Economic Development Strategy. And last year, according to CBRE, Phoenix led every city in the country in percentage growth of employment in the life sciences. That's totally different from where we were when the PBC was initially conceptualized. Next slide, please. So these are the 2 things where I really think we need to devote some effort and focus. We're building a lot of community through our event marketing activities among the people on the campus. But we know from some great work that ASU Knowledge Enterprises has done for us that the research community on the PBC is siloed. And we're not creating enough opportunity for them to meet and work with each other, to share the core services that are on the campus. So we conducted this core services audit, core research services audit, and we identified a number of what we're calling research opportunity accelerators. Those are opportunities for the research community to transition from this mostly siloed environment to really having a PBC research program where people are interacting with each other. So I'll just give you one example of that. One of the recommendations in the audit was to create regular opportunities for a Connect program where folks get out of their labs and meet each other. We started working with the Associate Dean for Research for the College of Medicine Phoenix and his counterparts at ASU's College of Health Solutions. So later this afternoon, we're having our first Researcher Connect program at the campus. We expected 20 or 30 people to show up for that event. And we're going to start by having a handful of these researchers share what they're doing and then culminating in kind of a reception after that. We've had 60 people RSVP on a Friday afternoon to participate in an event, almost all PIs and senior research people, where they have the opportunity to interact with each other. We have a lot of opportunity here to really, create some synergy. And we should do it because the investment is being made by the universities and TGen. And now we have the ASU Wexford situation going on. The last thing I would just focus on is that we have initiated an innovation assessment for the PBC. This is a strategic planning tool to really identify research activity that's occurring within our universities that is not on or connected to the PBC, but would really benefit from that connection. We're working with Tom Osha. He's the chair of the Global Institute for Innovation Districts, but also a senior partner at Wexford Science and Technology. He's done this assessment in a number of other Wexford locations. We've kicked it off with a series of interviews with key administrators and researchers at ASU. Tom was down recently at the U of A to meet with Betsy Cantwell and with Dr. Daig. So U of A will be our next target, and then we'll follow that up with the team at NAU, Interim Provost Polisi and Jason Wilder, the VPR there. So Chairman Duval, Regent Duval, thank you for the time. I do think that we have some immense changes that are occurring in Phoenix. I think the PBC, which is now the Phoenix Bioscience Core, is really strategically positioned to take advantage of that. And, I do appreciate having the university presidents directly focused on our activities. They're not shy about offering me advice and counsel. So that's been good.
Terrific. Thank you. Dave, thank you. Great, quick overview. Let me begin. I just want to ask you two brief things. First, the city has expressed through the years eagerness for us to pick up the pace, and I just would like to hear you address whether that relationship is where it needs to be. And then secondly, can you give me a description, this notion of a bioscience synergistic enterprise is not unique to Phoenix. They exist around the country and around the world. What's our unique selling proposition? Who's our customer? What makes, what are we going for in this competitive space?
Yeah, so let me take the second one first. So our most distinguishing characteristic is that we have all three of our state universities physically located in the same place, focused on health and life science education and researchers. That's very unusual among other locations that are trying to drive these innovation districts. So I think that if we can just kind of break through and really, especially in the research community, get people integrated and talking and collaborating with each other. I think we're very strategically positioned for that. And the hospital systems, we have these 5 major drivers. We have the VA as a major new tenant. They brought all of their clinical research in the Phoenix region into the U of A's research building on the campus. One quick example I'd give you of what the opportunity is. The chief research officer for Phoenix Children's Hospital was doing his basic science research in the U of A facility with a joint faculty appointment, developed this company called BacVax, bacterial vaccine. U of A stepped in to manage the IP through Tech Launch Arizona. And then now that the company has spun off, they've located in the ASU Wexford building because the core services are here. We have 2 ASU managed IP, where ASU is managing the IP for 2 companies here, Kildare and Oncomix. We could repeat that, and Phoenix has got a very powerful economic development attraction. We could repeat that dozens of times here. And having the ASU Wexford partnership, the physical space to accommodate these companies has made a big difference.
Excellent. Thank you. We've got a few minutes for questions. Colleagues, Regents, any other thoughts or questions that you might have? President Robbins.
Yeah, I just wanted to take the opportunity to congratulate Dave on all the incredible work he's doing. I finally, there was a topping ceremony in Houston at the Texas Medical Center for the TMC3 project, so-called TMC3 project, 1 + 1 = 3, or TMC3, the Third Coast. So that now is 10 years. It took 10 years. We had all of the universities, A&M, Texas, University of Houston, Rice, Baylor College of Medicine, MD Anderson, all there together. But even having them there together, it took a lot of work to get them to buy into this common collaborative, as Regent Schubman called it yesterday, collaboration. That's exactly right. So I would say that this is going to be one of my top priorities going forward. Is you'll hear from Dr. Dake later, but we're right there, close to our clinical partner banner. This CAMI concept, I think, is going to be incredibly powerful for the next 20 years of medicine and health, and having all the universities participate with that. Unlike when TGN went up and all 3 universities weren't really involved, I think that was a missed opportunity. Having Dave in place and giving him not only the responsibility, but the resources, not just money, but our collective resources to come together. I really believe, just like at Texas Medical Center, which, by the way, is 2,000 acres and 70 million square feet of built space. So we're not going to be that in our lifetime. But I'm telling you, I think President Crow was right by changing this name to the Bioscience Core, because if you extend that map that Dave just showed us all the way out to Mayo and what ASU is doing there, we really, I know I speak for Mike Dake. One of the reasons we wanted to come here is because Arizona is the future state, and it's the future state for health, because we're perfectly located between California and Texas. And I think if we all pull together and get over, even though we're there together, we really have to have, as Dave said, these programs that build off of each other, doing an inventory of where do I go to get someone who is an expert on whatever, neuroscience, a particular part of neuroscience, and have an inventory so that we can sell this to companies, and also build it through the farm system of developing companies through incubation and acceleration. And I think all of the elements are there. We are so close. We need to just stay on it and keep pushing. So thank you, Dave.
Excellent. Great. Regent Dave, was your hand up?
Yes, I just wanted to, thank you, Chair Duval. I just wanted to also echo President Robbins's words. I'm very excited to see the progress, as well as I think the audit raised some really great issues from the ASU Knowledge Enterprise. And I'm excited to hear that, there's already work being done towards those issues. I also echo what President Robbins says about Phoenix and being, a future hub for bioscience. And I can clearly see the PBC as the vehicle toward doing that. And in fact, I'm actually currently sitting in the PBC. I'm at the Wexford building, where, there's this great event about to take place, hosted by the Flynn Biosciences Center, the Arizona Biopreneur Conference. And so just another wonderful example of how the PBC is really rich in opportunity for convening Arizona's, very fast growing bioscience community. So thank you, Dave.
Excellent. Regent Dave, we're expecting when you finish your academic career and start landing big grants that you bring them home.
I will do, no doubt.
All right. All right. Any other regents? All right. Seeing none, Dave, thanks so much. You're terrific. Great pace, great work, very exciting, and appreciate your being with us. And again, apologize that we had to bump you from the last meeting.
Thank you.
You bet. Our next topic is the U of A's relationship with Banner Health, and Mike Dake is on tap for the presentation, but obviously President Robbins is with us, and so I'll turn it over to the two of you, however you want to divide the time.
Yeah, I'll just kind of just jump ahead of Mike here. Sorry, Mike. But to say that, we've had lots of discussions about the relationship with Banner. In my opinion, there's great opportunity there. Again, one of my selling points of recruiting Mike Dake away from Stanford to come here was the incredible promise of our relationship with Banner, with more than 35 hospitals across 5 or 6 states. It's enormous opportunity for us. There have been some major leadership changes at Banner with the departure of Larry Goldberg and a new president and chief operating officer, and Chad Whalen, who has been an incredible partner for us as the CEO of the 2 hospitals in Tucson, moving up to cover both Phoenix and Tucson. And by the way, Chad is staying in Tucson, which we love because he's an integral part of the community. I really, there are always going to be headwinds and bumps and, healthy tension. I've used this story many times. Even though Stanford's hospital was a wholly owned subsidiary of the university, and the board was populated with majority Stanford trustees, there was always this tension between the CEO of the hospital and the dean of the medical school. All wore the same jersey, but still this healthy tension, because as a CEO of the hospital, when you make $1, you want to invest that dollar in more operating rooms, more CT scanners, more people, better service, all that. And the dean of the medical school wants you to invest in the research and education mission, because the dean of the medical school will say, without my doctors, you're nothing. I don't remember the last time someone showed up to get a coronary bypass from a hospital administrator. So there's always going to be this tension. And when you don't necessarily wear the same jersey, or you wear a jersey that has 2 logos on it, then that tension sometimes can be even more intense. So I would say, from my perspective, that we welcome these new changes of leadership at Banner, and we have some very, very exciting things that are going on with Banner. And with that, I'll turn it over to Mike. But I would say that we need to I would suggest we have, I know this is not going to go over well, but I'm going to just blurt it out there. I would love to see us have a board retreat that focused just on this issue and develop a dashboard or some sort of reporting that we can disseminate information to the board in a regular, organized way that would help keep you all informed. With that, I'll give it to Mike Day.
Thank you. Mike?
Thanks, President Robbins. Thanks, Regent Duvall, and good morning, Regents. I'm mildly discombobulated this morning here in San Antonio. My computer, I'm not getting it on my computer, so I'm talking to you on my phone. Hopefully this will come through and we'll be okay, and you'll advance the slides. As President Robbins said, there have been some changes at the top level management within the Banner organization in terms of a new COO and a new president of the Banner University Medical Division. That, as you heard, was Chad Whalen. Chad is someone that we have worked very well with over the last 4 years. We trust him. He trusts us. I meet with him every week, sometimes more than once a week, to understand exactly where we're heading, what we need to work on. So I thought I'd take this moment to the time allotted to sort of go over with the board and give a status update on what we've accomplished, but what we also need to do and working on.
Jason.
Next slide. So what we've accomplished, breaking it into sort of the tripartite mission of research, education, and clinical service. Next slide. One of our biggest success stories as part of our partnership on the research side is the All of Us program. You may have heard of this. I hope so. It's a partnership started in 2018. It's a nationwide NIH initiative that basically hopes to get genetic information on as many people as possible with a goal of 1 million enrollees. We are capped at 100,000. We are now just surpassed 50,000, but that 50,000 number is by far the highest of any NIH group involved in the All of Us program. We have been since the very beginning on top of this. Very exciting. And these are groups like Harvard, UPMC, San Francisco. We have been leading the way in terms of All of Us. Next slide. Again, more than 50% of our Arizona participants are from communities that are traditionally underrepresented in biomedical research. And we've had more than 40 research teams conducting studies with data sets already coming out of All of Us. Across the country, there have been 329,000 enrollees, of which we have full genetic sequencing on 169,000. And we're already starting to get very valuable information from this genetic sequencing. And we can talk more about that at a later date. But in terms of our working with Banner as a partner in the Banner Health University of Arizona All of Us program, we couldn't be happier. Next slide. Hand in glove with that, we've worked with Banner to develop a Discover tool. Again, as Bobby said, sometimes systems, when you're not fully integrated, but still have a partnership, may not talk seamlessly with one another. But this is a tool that really allows our researchers better access to de-identified aggregated data within the Banner system going back to 2014. And already our teams are using this tool for studies in long COVID, cancer, Alzheimer's, heart disease, and others. Next slide. So basically, if you're a Banner employee, if you're a medical student, if you're a UA faculty, this allows you to basically, you obviously have to go through the IRB, but if you're contemplating a clinical trial or scientific publication, if you're looking to have a grant application or looking in terms of developing and quality improvement, this is going to make this much more efficient and much easier to access the data that you will need to support your proposals. Next slide. We just had a grand opening this week of our Health Sciences Sensor Lab. This is funded partially from our strategic plan initiative, but also from a new economy initiative. And this we're really hoping is going to have a lot of effects along with the clinical research partner as Banner. So we have opened this to all university researchers as well as our clinical research partners. Next slide. And this environment creates an incredible opportunity for interprofessional research collaboration, enabling real-time data gathering using sensor technologies, human study participants. The next time you're in Tucson, I'd love to show this to you. It's really quite amazing. And we'll be working with Banner to see how we translate these from the lab into actual clinical practice to benefit patients. Next slide. Education. And again, this is an abridged version. There are many more things I could mention. I wanted to hit some highlights, though, to give you a flavor of sort of the spectrum and range of things we've been working on. You may be aware of this program, which is a win-win between Banner and the U of A in terms of providing Hispanic-speaking nurses to go into the pipeline for Banner hospitals around the state. This is the new international nursing program in combination with the University of Sonora Hermosillo. Next slide. Our initial cohort has started and is in process with 25 students to create career pathways for international nurses. Students in Mexico who have an undergraduate degree will take an English proficiency test at home in Mexico and do the first year in Mexico online with nursing. Then for their clinical experience, come up to Arizona with Banner, everything with the visas, everything worked out. And when they finish and if they pass the state board in nursing, they are guaranteed a job within the Banner system with all the visa provisions taken care of. This is truly a win-win, and I consider almost a poster child of how we can address some of the current nursing shortages within the state. Next slide. Clinical service, next. A couple things in terms of cancer. With Banner's help, we were able to organize the establishment of a clinical trials network across Arizona. This allows smaller communities and rural communities that do not have a cancer center in their own locality to have the opportunity to access clinical trials within our UACC Cancer Center. They're doctors within their local area. I will be taking care of them, but with the working now with a partner within the UACC in this clinical trials network, which helps our accrual, helps get these patients exposed to the type of therapies that they may want to take advantage of and may benefit them. This is exciting. We already have 4 sites signed up and more to come. And it's not just for cancer. This will go across all departments in the future, including surgery and medicine. We also had a very successful site visit as part of the renewal process for our NCI designation as a comprehensive cancer center. This occurred a month ago, but we've already got reports back and our score was fantastic. The final word will come from the MCI at the beginning of May, but everyone is very confident and comfortable that we have passed our renewal for designation as an NCI comprehensive cancer center. We had a score that was much better even than it was the last time we came up for renewal. So big appreciation, a big win for us and for Banner. Next. This is a program and one of many, but I wanted to highlight this one in particular. It's called CEAL, CEAL, Community Engagement Alliance Against COVID Disparities. And this is obviously intimately related to COVID and the pandemic. This is a program that we applied for, and 11 states were granted this out of 50, and we were one in Arizona. Next slide. Our SEAL program includes a number of partners, almost a consortium, but University of Arizona Health Sciences and Banner are leading the way along with Arizona State, NAU, and Mayo. Next slide. It's an active community outreach and engagement within the communities hardest hit by COVID-19, including African Americans, Hispanics, American Indians, Alaskan Natives. And it's not just meant for COVID, but in addition to build long-lasting partnerships and help improve health. Next slide. We've known since the beginning of the pandemic that traditionally underrepresented and underserved populations have much higher hospitalizations associated with COVID. And you can see this on this bar graph here very clearly. Next slide. Through this consortium, and here's just a list on the right of the number of partners and the investigators, which stretch across, as I mentioned, U of A, Mayo, ASU, and NAU. We have been able to develop this program. We get approximately $1 to $1.8 million a year to run it. So far, this is our third year, so we've had $4.2 million in total. Next. It involves going throughout the state, and especially in rural areas. And you can see all the number of the healthcare communities that we interact with. Again, this is the state, but you can just see by the number of dots, and on the left is those particular types of organizations. Next slide. But again, the idea was to provide science-based information through active community engagement and outreach to the people hardest hit by the pandemic, with the goal of building long-term partnerships, as well as improving diversity and inclusion in research response to COVID. Next slide. Again, by disseminating, promoting COVID prevention practice in a culturally appropriate manner, we've been able to address vaccine hesitancy and promote vaccine update. And this has facilitated inclusion of diverse racial and ethnic populations that really have not been represented before in COVID-19 clinical trials. Next slide. And that has brought in, and you've heard about this before, our mobile health units, which have been going all over the state to look at this, to work on it in very rural communities. Here you can see in a tribal nation, our U of A mobile health van run out of public health. So how valuable has this been, and how do we know if we've been successful? Next slide. Well, this is actually published this month in the CDC's mortality and morbidity review. This report is widely read by epidemiology, public health, all the healthcare community. And the title of this article is Disparities in COVID-19 Vaccination Coverage Between Urban and Rural Counties in the United States. And I've just excerpt one paragraph here, and it says, some exceptions to the general trends were observed in this study. Although vaccination, and we're talking about vaccination here, coverage was nearly universally higher in urban than rural counties, Arizona was the only state where coverage in rural counties was higher than in urban counties. And this was covered, next slide, nationally by NPR. And here's just a little piece from our NPR.
A new CDC study of COVID-19 vaccination rates shows the nationwide gap between urban and rural areas more than doubled in the past year, with urban counties beating rural counties everywhere, except in Arizona. First dose vaccination coverage was less than 59% in rural counties nationwide versus 75% in urban counties, with the largest gaps among children and adolescents. Similar patterns held true for second doses and boosters, but not in Arizona, which had higher rural rates than urban. Dr. Dan Dirksen, who directs U of A's Center for Rural Health, was not surprised. He cites cross-border collaborations, efforts by the Navajo Nation, and county successes in bringing vaccinations to rural laborers.
They were very creative about ways to get vaccinations out to the harder to reach populations.
Dirksen says the work of educating and making vaccines available to all Arizonans is not finished. I'm Nicholas Purpose in Phoenix.
Next slide. Next slide. So here, just a partial listing of all the rural initiatives and collaborative rural outreach that we've been doing and partnering with Banner at the University of Arizona to really reach rural populations in Arizona with vaccines. And that's why this was successful. And that's why we were the only state that showed better rural vaccination rates than urban. Next slide. Okay, so we've got a lot that we've worked on, but we've got a lot more that we need to accomplish. And this is what we need to do. And I'll go through the same three areas. Next, education. Right now, we're working, okay, I was going to say something else, but that's okay. We'll move right. Thank you. About GME. We're working with Banner to open up various other Banner facilities to graduate medical education programs, trying to decide what specialties, what departments, what graduate programs would go into what other Banner hospitals and take advantage to increase. Again, it's not just enough to increase medical students, as you're well aware. We need to increase residency training slots. And through GME, we want to do that with our partner Banner. And that's an area of very prime focus right now. Now, next slide. In addition, as you've heard, we're working to develop more medical students. One of the initiatives that we hope to do that is a global partnership with an international medical university that we're going to be partnering with the University of Western Australia and U of A and Banner. Next slide. Again, studies will study on both campuses and research clinical pathways to ultimately fill shortages of physicians and care delivery that's going to be focused on Arizona. This is in development. Once we're ready to bring it to the board and hopefully for approval, we will certainly do that. Right now, we have hired a director dean for this and working with Western Australia on a weekly basis to develop curriculum and try to get scaling figured out as well as timing. Next slide. How about clinical service? We've done a lot, but these are the three areas I wanted to draw your attention to that we're really focused on going forward over the next 6 months. Cancer, sports medicine, and transplant. These three are very important to both organizations and especially to our partnership. And we are working very hard to ensure that we can improve on all of these so that we become the go-to location for all three of these within Arizona. I think I'll stop there. And if there are any questions, I'm happy to take them.
Terrific, Dr. Day. Great stuff. I mean, the breadth and pace is fantastic. So I'm sure there are going to be some questions. And I also, just while I've got the floor, want to tell President Robbins, I thought the idea that you started with was just terrific. I mean, we want to be a governing board, and the idea of trying to move towards some kind of a tool, a dashboard or something that where we can track your progress and success would be fantastic. So thank you for that idea. Questions from Regents? Can't see everyone on the screen, so speak up if you've got one. Regent Manson.
Thank you, Chair Duvall. Can you talk to me a little bit more about the GME process? What the status is now and where we're hoping to go with that? So I know that's that in addition to creating more MDs is a big deal.
Sure, Regent Manson, absolutely. Our overall goal is to train more physicians who are specialized in GME training in Arizona so they stay in Arizona. That requires we have more slots. There's always a balance between our two loci of Phoenix and Tucson and trying to make sure we've got the right recipe to balance that out. But I think there's clearly an opportunity, and it's time sensitive because the government is now up until July 1 entertaining abilities to offer new GME slots. We have to be very strategic about this, and we have to have extreme high consideration of which slots we want to increase and where they're going to be increased. We have pretty much have Phoenix and Tucson figured out in talking with Banner. I think that is at least in Phoenix, it's about 80% done. In Tucson, I think it's completely done. But the real work to be done involves other Banner locations where we could open up new slots. What financially is required to do that? Which programs would go into which other facilities? It's not that you'll open comprehensive every single OB-GYN, peds, surgery, et cetera, in every hospital. Will have to be selective. And really, that's the process that's going on right now. Those are the discussions that we're holding. And, we will get it done because we have to get it done to take advantage of these time deadlines.
I'm sorry, what's the government involvement in this? Is there is this an accreditation issue with number of spots or?
Well, that's part of it, but also it's money. Okay. So we get money from this it's a long story, but I don't know if someday we'll.
That's why I wanted to raise my hand. This is why, I mean, my room is 510. You can come down and get on my computer. We can go to the telestrator here. Because following the money of GME is one of the more complicated and nuanced things that will really need to have. We need to write a white paper and give it to you about how the money flows. Suffice to say, it comes from the federal government through CMS, the Center for Medicare and Medicaid, and it flows to the hospital. Banner gets this money, and then it's distributed, and there are a certain number of slots that are approved, and it's you're always talking about how many positions you are over the cap. And at first glance, it would look like that Banner makes a lot of money off of GME. Yet, for instance, we do not have an anesthesia residency in Phoenix. We've tried, we've pushed, we begged in order for Dr. Nakaji, who was recruited over for the Barrows, to have a neurosurgery residency program. One of the requirements is having an anesthesia program. In order to have an anesthesia program, Banner has to create the slots in Phoenix. Now, that may mean what we're in the discussion about is taking away spots in Tucson to go to Phoenix. And of course, that's not going to be very popular in Tucson, but we are absolutely committed to Banner, to working this out, to having a so-called statewide GME program where these positions would be fungible and would be utilized in the areas where we thought we needed them the most. I think anesthesia in Phoenix is one of the highest priorities in GME. I think that emergency medicine, there's no residency program for emergency medicine in Phoenix. So these are the kind of detailed nuance in the weeds, as you say, discussions we need to have. The money you will find very, very interesting, because there's also some maneuvering with DISH and Medicaid dollars that are a combination of state dollars. It's actually kind of a fun thing to look at, but we can't, even with slides, it's going to be tough. But we'll commit to giving you a white paper and then a color commentary on this. And I'll tell you, I can tell you one thing. Dennis Laraway, who is the CFO at Banner, we worked together for years in Houston. Memorial Hermann in Houston, under Dennis Laraway's leadership, was one of the absolute masters at this game. So we're on this. It just takes a little time.
And I would say the landscape, Regent Manson, has changed in the last 2 years almost, so that access money coming through the state to fund this is almost as much or more than the feds. It's very rapid. It's a shifting sands. And as President Robbins said, there's strategies in here. Now the money comes to Banner, but we administer these programs. So there's a clear interlock here. And this is like, as I mentioned, a very keen area of focus for us right now.
And while we're on money, I just want to I keep saying the same thing over and over. I'm like a McKinsey consultant. I got 3 points here. One, you break even in the hospital business on Medicare. Break even on that. You hope to. You lose money on every Medicaid patient. Just, you do. And then you try to make the margin in the healthcare business off commercial insurance. And so the way you do that, let's just take Tucson, for instance, is that you have premier clinically expert services, whether it be not because Mike Dake and I are interventionalists, we used to play interventionalists in former lives, but that's where the money is made. You don't make a lot of money on seeing patients, giving them a pill and telling them to come back and see you in, 2 months. You make money on doing big time operations like neurosurgery, like sports medicine, like heart transplants, like liver transplants. So that's where our, and Mike, I don't know how many, I think there's 17 clinical department chairs in Tucson, and you and Mike Abacazas have changed 8 and on your way to changing 10 of those side by side, hand in hand with Banner, because Banner provides the money to recruit these people. So, that is going famously, but they're going to have to then recruit people and build out programs so that people don't drive to Phoenix to go to Mayo to get their hip replaced, on and on and on. So that's another really, really important topic that we are with Chad and Dennis are working hand in hand to try to solve.
Thank you, that's helpful.
Very helpful and great, Adam, for follow-up. All right, I think we need to, Regent Ridenhour, I see your hand.
So, Dr. Day, can you kind of give me an overview, not of cancer, but there was always this, so where is the relationship with Banner and the U of A with regard to cancer? Because we had the U of A Cancer Center. The U of A previous had another association. There's the Anderson Cancer. So what are we really working on together in the cancer area?
Yes, happy to do that, Regent Ridenhour. Let's take Tucson. Tucson, as you know, is the UACC, University of Arizona Cancer Center. Our partner is Banner in Tucson for clinical service, for all these programs. And we have also, as I mentioned, launched this clinical trials network out of UACC around the state. So for research and clinical around the state, clinical trials network is good. In Phoenix, in Maricopa, we were with Dignity, as you alluded to. We have since severed that tie, and Banner is with MD Anderson. So at this point in time, we have are awaiting some a review and basically a report from internal consultant about internal consultant at Banner about how we can work together with Banner MD Anderson on research and clinical in Maricopa. They have a relationship. We don't know the exact, we've never seen that agreement. So we have to kind of depend on them to give us obviously the opportunities where we might be able to work together in a way that's synergistic, collaborative, and benefits us so that we can try and pull the seams together between Tucson and Phoenix in some way. But right now, how we've done it with the NCI with Tucson, it's been very successful. They were very happy with why we have a statewide catchment program for research based out of Tucson. And we have nodes in Phoenix, such as the Phoenix VA and others, but we have to really wait for Banner and MD Anderson, to give us the overture of how we can work together on this. We can start with research, we can start with clinical, we can try and figure that out. But again, that is sort of the current status update on cancer.
Excellent.
Yeah,
Thank you, Dr. Day.
Could I just add one caveat to this? You can only say this so long, but it still doesn't change the fact that we're not trying to obfuscate or give excuses or reasons, but the facts are, when this agreement was signed, there was a relationship between Banner and MD Anderson and between the U of A and Dignity. And to change that has taken a tremendous amount of work. It's one of the first things that I tasked Mike Dake with when he got here. And it's complicated to get out of a relationship with Dignity because they saw that Creighton was coming. They wanted to be there. We wanted to be with Banner. We were in the middle of this NCI re-accreditation process, and we didn't think that we could make any move on that. I actually, when Irv Crone was here, he and I went and visited the NCI in Bethesda and talked about, wouldn't it be great to have Banner, MD Anderson, U of A all together? And they were very proscriptive in telling us, you need to keep it separate until this review is done. Now that it's done, we are going to spend an enormous amount of time trying to figure out what we can do with MD Anderson, Banner, and the U of A together. That's going to work well in Phoenix. It's going to be a little more challenging in Tucson, but I can tell you that Mike and Chad and Dennis and I, and now Amy are, we're all going to go after this. And obviously, I have previous connections at MD Anderson and been talking to them. So this thing will get solved in the next 12 to 18 months. And this is another one that will take almost a day of our very exciting 3-day retreat we're going to be planning.
The first day is just going to be GME financing. Excellent. Well, thank you all. Great discussion. Obviously, work that we'll continue to do in the months and years ahead, but very, very exciting. Appreciate all of that. And we're now going to move to our third item, which is the Regents grant proposals. Let me back up. So everyone is familiar with our history of TRIF, 30 years of funding the university's research, an incredible array of successes and exciting work that's taken place over 3 decades. TRIF, as we've talked about, is a unique funding source because it's directly a piece of sales tax, which comes from every family at the store, everybody buying a cup of coffee at Starbucks or bowling on Saturday night. It is direct public investment. And given that, the Regents have pioneered a pilot idea as to whether we can partner with the state and identify policy areas where the state needs our support, our talent, our researchers, and that's the context of this topic. So what we did is we went to the state and to a variety of departments, health sciences, environmental quality, Department of Commerce, et cetera, and said, what ideas and areas do you think you could use university support? We received 17 proposals back from the state, and it really was across the board of state government. And actually, since then, I would add, I've heard from 2 additional department directors saying, gee, I didn't fully understand the potential here, but I'll be in the next round. So a very positive response. From those 17, the selection committee narrowed them down, working with the VPRs to 5 requests that are before us today. And Ken Pelasco from the ABOR team is going to lead this discussion. We're going to seek to approve these 5. And what I'm going to ask everybody's forbearance is we're going to move to number 2 first, because we're going to spend a few more extra minutes on that. We have 2 presenters from the universities around that. So this is item number 4. And so Ken, if you would lead us into this. I think our guests, we have with us John Galgiondi, I hope that I pronounced that correctly, from the U of A, and Dr.
I've been called worse.
Oh, I'm so sorry. Yeah,
It's good.
I apologize.
You did very well.
Dr. Farron Garcia Pitchell from ASU. They have collaborated on proposal 2, which pertains to Arizona's need to identify, characterize Nat Valley fever hotspots and seek a cost-effective solution to Valley fever. And so I'm going to turn it over to Ken and to our university researchers.
Regent Duvall, thank you, Regents. It's exciting, and really what I wanted to do here in the interest of time, to go right to the faculty. They are the world's experts in this area. They are the folks that are excited about doing this work, very important work for the state of Arizona. So at this point, let me turn it over to John and his team.
Right, and very important in putting this together was Neil Woodbury. And Neil, could you get us started here?
Sure. Thanks very much. And thanks, Regent Duvall. Thanks to all of the regions here. I want to first just give a shout out to Ken. None of us actually knew how we were going to do this or how it was going to work. Ken worked really closely with all three universities over a period of time and really was tremendously patient and careful about making this go forward. And so thank you, Ken. That was great that you did that. So what you're going to hear about today is a proposal that the three universities came together on in a really important way. And John Galgioni will talk about what it means in terms of valley fever and its clinical relevance. But what happened was when we realized that ADEQ was really interested in dust and the health manifestations of dust, we realized this was one of the key health manifestations. And at the same time, which is valley fever, this fungal disease. At the same time, John Galgioni was developing a collaborative across the state. He was trying to figure out a way to bring all of the different resources together to try and come up with a solution to this disease from its many different angles. But this offered an opportunity to say, well, can we as three universities get together and look at the disease in terms of mitigation at the source? The source of this disease is the soil. And it turns out that it's present in very specific places. And can we, in fact, think as a group about soil science, about air, about the aerosolization of the spores, about the clinical manifestation of this, and come up with a set of solutions that would really benefit the state? So that's what the team is going to talk about today. And with that, I'm going to turn it over to John.
Thank you, Neil. Thank you very much. And Chairman Duvall, appreciate the time to present this. This is actually, as Neil mentioned, as you mentioned, this is really two different proposals. We're going to talk first about environmental sources of valley fever and how that causes disease and how identifying that might be important. And then a second one, which is the dust mitigation, which Farhan will talk about. But they fit together very nicely because one identifies the problem and the other, perhaps, some of the solutions. If I could have the next slide. So as you probably all know, valley fever is a fungal infection. It's a fungus that's endemic to certain parts of the country. The Sonoran Desert is an important part of the endemic regions, and it is why we get valley fever here in Arizona. There are about 20,000 U.S. cases, that is reported cases. It's quite a bit underdiagnosed, but about 20,000 U.S. cases reported to the CDC per year. And maybe a very kind of important point to emphasize here is that Maricopa County is the source of 1/2 of all U.S. infections. And that one county, us here, is 1/2 of all U.S. infections. In fact, the state of Arizona in general is 2/3 of all U.S. infections. So we should really be the right place to be doing something about this disease. Valley fever, Seidman Institute Economic Impact found that valley fever cost Arizona $750 million in 2019, and that's roughly half of the cost to the country. So it's about a $1.5 billion disease per year to California and Arizona primarily. I'd also emphasize there is no vaccine, although we have one candidate, and I'm very excited about the idea of trying to bring that into clinical trials, but also there is none yet, and there is no cure for this disease. We have drugs to treat this, but none of them cure it. Neil mentioned that we have developed a valley fever collaborative. That's as part of ABOR's New Economy Initiative. And the point here is that valley fever has economic impact, and managing it is probably a much better thing to do than to just think that it doesn't exist. Next slide, please. So let me touch on a few points that we're pretty comfortable with as settled information. First of all, the fungus, it turns out, even in the hyperendemic regions, is only in very small parts of the terrain. It's like wildflowers. It's some places, but not others. And it's a very small percentage. And at those locations, the genetics of those strains is stable for decades. And so there are genetic signatures for where those different areas are located. And what we don't know is where patients get their infection. We know it's from the dirt somewhere in presumably Arizona here for patients here, but we don't know the exact location. And we also don't really have very clear guidance as to which soil characteristics are identifying those soils where the fungus might be. And finally, obviously, and this is what the second half of our presentation will focus on, is can we keep the spores out of the air? And that are the sort of the drivers which we want to try to get to with our research. If I could have the next slide. So just as an overview, and the following speakers are going to talk about this in a little bit more detail, we're going to look at isolates from patients, and we can get those from clinical labs and do the sequencing on that. The soil samples will be developed with procedures that NAU has been refining, and air sampling will be done with a lot of engineering skills from ASU. The analyses will, and we'll hear about that in a moment from Jason Saul, will be DNA sequencing and assembly of that sequence into genomes, and also then from work done in the soils group here at U of A, analyzing the soils where those isolates are found. And the kinds of deliverables we're trying to produce for you is finding clusters of patients where we might be able to identify hotspots to see exactly where those particular patients got their infections, or the soil characteristics that show where the fungus is likely to be, so we could identify things for better mitigation. And finally, applying dust mitigation strategies, and that's what Farron will talk about towards the second half. And with that, let me turn this over to Jason Saul, who will tell you about the sequencing strategies. Jason.
All right, next slide, please. Thanks, John. So we know that culturing coccidioides from the soil or from air filters is difficult to impossible, but to understand the connection between the environmental strains and the clinical strains, we have to get the entire genome. So if we can't do that through culturing, we've come up with an alternate approach called bait enrichment. And so the way that this works is we design these RNA probes targeted for the coccidioides genome. We can apply that to these soils that come up positive through other tests. We can amplify that signal up, and then we can sequence it. And once we do that, then we can start finding those matches, identifying the risk, and then informing mitigation, dust mitigation strategies. And so we've used this approach for other systems as well. Perhaps the most notable is, the picture in the middle is from Bacillus anthracis, the causative agent of plague, which has caused 3 pandemics throughout human history, has resulted in millions of deaths, and is a disease that's still here in Arizona today. And what we can do is we can go to these skeletons and these burial sites, and we can extract this kind of poor quality degraded Yersinia pestis DNA from human teeth, amplify it with this bait enrichment system, sequence the entire genome, and then understand how it's related to contemporary strains, including those that circulate currently in Arizona. On the right is another bait enrichment system that we developed for Francisella tularensis as the causative agent of tularemia, another disease that's present in Arizona. This is from an air filter. And so the blue bar there is for pre-capture. That's the DNA that's present on that air filter. It's way too low to work with. It's got other bacteria, other fungi, et cetera. And so by using this bait enrichment system, after 2 rounds of enrichment, we get about 100% of the sample as Francisella. So it just represents a really powerful method to amplify this low-level signal out of an environmental sample, so then we can compare it to other strains. Next slide, please. And so whether we have enrichment data or we have clinical data, which will, these clinical isolates that will also sequence as part of the sample, we sequence it on the sequencer and we end up with sequence data. And so once we have that sequence data, we can either assemble the genome, and so that's done with these really powerful computational algorithms. And once we have the genome assembly, we can look into virulence-associated genes, or we can look into genes associated with antifungal resistance, which may inform different treatment strategies. We can also map the data back against a reference genome. And by doing that, we can understand how these environmental strains are related to clinical strains, which will help find those matches. And we can understand how they're related to strains in California, Mexico, other parts of the world. And so this whole genome sequence data represents a really powerful tool to identify these matches, inform mitigation strategies, and understand the risk due to human exposure of dust. And so with that, I'm going to pass it over to John for his part of the project.
Thanks, Jason. Next slide, please. Hi, everybody. I'm John Shorover here at the University of Arizona. And together with Professors Matt Fraser and Pierre Herkes, both at ASU, we're going to be working on field characterizations of soils and associated aerosolized particulate matter to better predict these hot spots and hot moments of cocci mobilization and spread in the Arizona landscape. Since, as John pointed out earlier, pathogenic cocci appear to be prevalent at distinct locations and they're stable over time, my lab's job is going to be to determine what physical, chemical, and biological features are unique to those environments supporting and sustaining cocci occurrence. So my team's going to also measure the soil microclimate dynamics, including meteorological conditions, soil moisture, and temperature that give rise to these episodes of aerosolization of particles. And typically, we're going to focus on particles that are small enough to be inhaled, commonly referred to as PM10 because they're less than 10 micrometers in size. The production, composition, and size of the aerosolized soil and fungal spores, as well as their sourcing and transport behavior, will be measured by the ASU team that's assembled by Matt and Pierre. Next slide, please. So the characterization of host soils and aerosolized particulate matter will involve state-of-the-art methodologies in soil and atmospheric chemistry. We will install field-based sensor and sampling networks at each of the several locations that are arrived at by our larger multi-institutional team. The sensors are going to enable us to relate weather conditions like wind velocity, wind direction, relative humidity, temperature, recency of rainfall, things of that sort, to the conditions of temperature, moisture, and matter and energy flux that's occurring in the surface layers of the soil. Using these data, we're going to establish predictive relationships between soil conditions and aerosolized dust that's being produced and transported off-site. The soils are going to be sampled, brought to the laboratory, and in the laboratory, they'll be subjected to a multifaceted set of analyses using X-ray diffraction, mass spectrometry, ion chromatography, and a variety of spectroscopic and wet chemical techniques for organic matter characterization. So the overarching goals of this part of the project are to supply data that will support the geospatial monitoring and visualization of valley fever data that's being conducted by John Miller and Sean Dudley at ASU. And we will, as a multi-institutional team, then be able to better predict where and when these in Arizona these valley fever spores are being generated and circulated. And then finally, ways to mitigate that aerosolized dust more generally are being developed and explored by Dr. Ferran Garcia-Paquel and his team, and he's going to discuss that next. So Ferran, it's all yours.
All right, thank you, John. Next slide, please. So let me talk to you about dust a little more. The problems that you have heard about dust being a vehicle for the cocci of coccidioides or valley fever are certainly there. But the problems associated with dust are multiple. So there's impacts on public health that go beyond that. Airborne particulates promote many respiratory ailments. And dust is a vehicle for many pathogens and allergens. Next, please. So we tend to think about dust when we hear about Haboob, and that's when the public opinion sees the importance of dust. But here's some data from a recent study of ours, and many of our colleagues here were involved in this study, where we have 1 year in the life of dust production in Pinal County. And you can see that certainly there is spikes in the production, but the problem is a constitutive problem. Dust is always there. The most interesting thing of this study, I think, was that we also use these genetic methods that you have heard about to see who's being transported in the dust. And it was amazing. Sure enough, we could detect the cocci spores, but also we detected a myriad other biological agents, some pathogenic, some not, but we could detect things like viruses, not just animal viruses, but also plant viruses. We could detect fecal coliforms associated with application of manure to fields. In some of these cases, those biological agents had the genetic potential for antibiotic resistance blowing in the dust. And so this is what we call the known unknowns. And so beyond public health, also next, we have an impairment of transportation. Next slide, please. And also next, loss of topsoil, which decreases the fertility of the soil and increases the certification. Next, please. So next slide. So with this in mind, we thought it was worth for us to develop a way to attack this at the source, keeping dust from forming at the source or keeping soil stable against wind erosion. So one thing that is very important to realize is that pristine desert is not a significant source of fugitive dust. And the reason next is, maybe you can see that back on the slide. There's a picture of microbial communities, natural microbial communities that grow on the surface of desert soils called biocrusts that actually provide a protection from even hurricane force winds to the formation of dust. And incidentally, none of these microbes that forms this natural protection of the desert were detected in our 1 year long study. So this must be telling us something. But unfortunately, some very large areas of impacted soils in central Arizona are a source of that dust, particularly fallow agricultural land, which is a prime target for intervention as determined in the by the Board of Regents plan. And so we developed this a proposal called Deploying Sustainable Technologies for Suppression of Fugitive Dust and Maintenance of Fertility in Fallow Agricultural Fields. Next. So this was an opportunity for us to bring together two technologies that have been developed independently by two different labs. Let me tell you about the first one, EICP, developed by Professor Kavazanjian, which essentially it's based on the bio-inspired formation of a carbonate crust on the surface of the soil. And so I put the chemical formula of what the process entails, but essentially it's a very simple application of a reactive form that results in the formation of a carbonate, a mineral cover on the soil. And the results of this are immediate. Also, what's interesting about this process is that in the process of reaction, it releases ammonium, and this ammonium is, of course, a fertilizer. And so there's two potential benefits of this. This technique is ready for deployment. It has been field tested in landfills by Professor Kavazanjian's group. And so this represents sort of one immediate reaction. Now, we don't know much about the long-term stability of this crust. And for this, we have the second application, which, next slide, please, which I have been developing during the last decade. And it has to essentially or simply try to promote the growth at those locales of the natural crust that provides the natural protection to pristine desert soils. So restore and accelerate those natural biocrust developments. So this is a little bit more complex in terms of, next please, in terms of application. You need to take the microbes, grow them in special facilities, and then produce eventually a crust that resembles the natural one to be able to inoculate the field sites with it. As before, we have tested these applications in solar fields here in Arizona with good results. And so this is also ready for deployment. The advantages of this, as opposed to the other EICP, is that while the approach of developing this crust takes longer, the biocrusts are living structures. They're self-sustaining, self-healing. Biocrusts also contribute to further trap dust from the air, and they are natural sources of fertilization of the desert by fixing nutrients from the atmosphere. So next. So the plan is very simple for us. We have, in collaboration with Pinal County Air Quality, we will set up 3 1-acre fields. In one, we will deploy the ICP. In another one, we will deploy the biocrust restoration. And very excitingly, I think for us, is we will try to combine the 2 approaches in a 3rd plot for a 1-punch, 2-punch approach to this problem, where we would have an immediate result and a long-term self-sustaining result. Next. During that time, we will provide, with the help of Professors Fraser and Herkes, we will provide a way to monitor the production of dust and hopefully the decrease in that production as we monitor that crust formation of development or the stability of the soil, and also the increase in fertility of the soil. So eventually, we will provide an analysis of the data, and it is also our plan, next please, to provide demonstrations to stakeholders as to how beneficial these techniques can be at a larger scale.
Dr. Garcia-Pichel,
Yes.
I apologize for interrupting. I think it will be in your interest that we make sure that we can vote an approval on this project before
yes.
we move forward at 10:30. So I'm going to ask you to sort of get to the punchline. That we've got the 4 other topics, 4 other proposals to review. So I apologize, but I do want to make sure we get to a vote.
No problem. I'm done. Just my last thought is that in these proposals, we actually are very excited at the possibility that the previous team may be able to tell us exactly where these hot spots for valley fever, and we'll be ready. The Dustbuster team will be ready to go and seal them off.
Terrific. Well, thank you. I feel like I just got a PhD in microbiology. I don't know if anybody else followed most of that, but it's certainly impressive. So here's what I want to convey and do so with the goal of adjourning on time and keeping our quorum. We wanted to go deep on one topic, sort of to give the board an illustration of what we're going for. This was a state identified goal with significant public benefit that lent itself to collaboration across multiple universities. And that's sort of the benchmark for the 5 proposals that we're bringing before the board today. So what I'd like to do is ask Ken to summarize the other 4, and then ask the indulgence of the board to hang with us, and we'll move them all at one time if there's no objection to that. But Ken, let me turn it over to you for a summary of the other 4 proposals, please.
Chair DeVaul, thank you. What you just heard is what we are calling problem statement number 2, valley fever and dust, and there are more details in the Regent's materials for all these. I will just give a very quick high-level summary. Problem statement number 1 is ground level ozone. One point here, this is not typical, the typical ozone hole that you hear about in the stratosphere. This is ground level, major health implications and also economic impact implications. This proposal is a bi-university proposal, University of Arizona, Arizona State, and the Department of Environmental Quality. The request is for $2.8 million over 3 years. You just heard about problem statement number 2, valley fever and dust, that, as you know, is a tri-university. The request there is $4.3 million over 3 years. And there is also an advisor from ADEQ and from ADHS that will be working with the faculty team over the time period of the project. Problem statement number 3, these forever chemicals, PFAS, known as PFAS. This is again, another bi-university proposal led by University of Arizona and Northern Arizona University and the Environmental Quality Advisor. The request there is $1.4 million over 3 years. Problem statement number 4 is abandoned mines. Even after a history of 150 years, more than 150 years in mining, there was no one comprehensive database They are going to put one together along with the associated risks and a risk assessment algorithm and a visualization tool. This is a tri-university program. The request is $1.5 million over 3 years. The last problem statement, number 5, deals with recycling. As everybody knows, in 2018, China is refusing to take our 7 million tons of plastic. This has created real issues in terms of recycling, especially for medium and smaller sized municipalities. The ASU and NAU and Environmental Quality are going to lead a study on what are some of the options for these smaller municipalities in terms of recycling. The request here is for $1.6 million over 3 years.
Terrific, Ken. Thank you for that summary. So let's take these 5 as a package, and let me just open it up to the board. Any questions of Ken or of our Valley Fever team before we consider approval? Any regions with questions or comments? And I don't see you all, so if there's anyone, please speak up. Okay, well, terrific. So what I would like to do is move this as one package motion. We were going to take them individually, but unless there's an objection, I'd like to take them as a group. And before doing so, just want to thank you, Ken, for your leadership on this. The VPR is obviously, this has been a pioneering effort, but the quality and breadth of the feedback from the state and the gratitude that we've lent our talent, our expertise of our faculty to them to address issues for which they lack the resources and with enormous public benefit is really great. I think we're making real tracks here, and I'm grateful to you. So I would like to move approval.
Fred, very quickly, I have one
Yes.
question. So the
Yes,
numbers that Ken was talking about don't match the documents I have. Was there an update? So
Regent Manson, they should have been in the one. I did see the materials that went out, and they were in the materials that I saw. The funding for the individual projects.
right. So for instance, and I'm sorry, I just want to make sure we're approving what I think we're approving. The project number 2, and I don't know if this is 1.3 and 3.9 over 3 years.
That's correct.
Project number 1 is 870 and 2.6, and I think you said 2.9. So I'm just
project number 1 I have is 2.8 million. Again, that's rounded. Project number 1.
okay. So there must be a different. There must be.
I think that was an older version that you have.
That's all I was asking, was if there was an updated version. So that's fine. Thank you.
Then let's just take a minute. Ken, if you have them available, would you give us the numbers again for each of the 5?
Yes. So problem statement number 1, ozone, $2.8 million over 3 years. Problem statement number 2, valley fever and dust, $4.3 million over 3 years. Problem statement number 3, the forever chemicals, PFAS, $1.4 million over 3 years. Problem statement number 4, the abandoned mines, $1.5 million over 3 years. And problem statement number 5, $1.6 million over 3 years.
Chair Duvall, may I jump in here?
Yes,
We will
please.
make sure that we'll update these as the board actually votes on them in April.
At the April full board meeting. Very good.
Because I think there's still some outdated materials the regions have where we haven't updated with the additional funds.
Okay. Terrific.
Here, I have a question.
Yes.
This is
Big
Bob
Herbold.
Herbold. These are all TRIF dollars, right?
Yes.
Okay. Thanks.
Yes, and let me back up. So TRIF is obviously a piece of the sales tax, and what we had is a significant last year, and even more so this year, significant uptick in sales tax revenue. So we're using this surplus funds to both, as you know, because we voted on the last meeting, move additional dollars to the universities in the traditional TRIF formula, and in addition, have these new region set aside.
That's what I assumed. Thank you.
You bet. Any other comments or questions from board members? All right, I would like to move approval of our first 5 Regent grant beneficiaries: ozone, valley fever, contaminated water, abandoned mines, and recycling. Do I have a second?
Second.
Moved and seconded. All those in favor, please say aye.
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 Any opposed? Any abstentions? Very good. Motion passes, and congratulations on great work. Off to the races with the state, and I really do think this is exciting stuff, and want to express my appreciation to all of you that have been involved. And unless there is anything else to come before the committee, we are right at time, and I appreciate everybody's attention to the clock because we kept a quorum. So appreciate seeing you all, and with that, our meeting is adjourned.
Thank you.
Thank you.